Okay, so hi everybody. Welcome to yet another episode of the Health Innovators. I am really excited to be sitting across from Dr. Alex McDonald, right, sitting across. You will notice that I am in a different place. I'm away on business, so my apologies for not keeping the background consistent. Hopefully I'll be forgiven. All right, for those who don't know, I'm Donna Coriel. I am the founder of SoMeDocs, and we are bringing to life this series with incredible people that are thinking out of the box. So without further ado, Dr. McDonald, tell us a little bit about you and about your training.
Sure. So I practice family medicine and sports medicine. I originally grew up in the East Coast and then slowly kind of migrated south and then west, and now I'm in Southern California, where I practice full scope family medicine. I see everyone from newborn babies to older grandparents, and I do a lot of office-based procedures. Basically, I joke if I have a needle long enough and an ultrasound, I'll basically inject almost anything I can find. And then I also practice some hospital medicine as well. I round in the hospital as well, and then I get a wonderful opportunity. I work at a teaching clinic where I have residents and sports medicine fellows working with me as well too. So I like to joke that I get very bored easily doing the same thing over and over again. So I've found lots of different ways to keep my days busy and also enjoy different aspects of what it is to be a family physician.
Amazing. You're almost like a jack of all trades.
I try. Well, it's funny when a lot of patients come see me for the first time. They're like, I need a referral to my cardiologist, to my orthopedist, to my nephrologist, and to my dermatologist. And I was like, why? I can do most of that for you. Yeah, I can't do everything, but I can at least get started with most of those things. And people find that very refreshing. So I like to say I'm very sort of possessive of my patients. I don't like it when I go on vacation. I don't like other people covering my in-basket, my messages, because I love that relationship I get to build with my patients too, because that's what it's all about.
Incredible. I love to hear that. And generalists are just so special. And I'm not biased or anything coming from an internal medicine field.
Right, of course.
Medicine really does it all, by the way.
We really try to, and I like to, I'm biased, obviously, but I really feel like there's been really good, robust data showing that every dollar you spend in primary care, you save $13 down the road in additional healthcare costs, right? And so I really think that we want to careful. I'm going to put my health policy hat on now. If we really think about how we're going to curtail this massive explosion in healthcare expense, we really need to think about investing in primary care and in family medicine, where it's holistic, it's patient-centered, as opposed to these small fragmented buckets, which is unfortunately what our system has become.
Absolutely. And I totally agree. And I think it's important because we also focus on preventative medicine, whereas the specialists that get more of the attention, sometimes they see the patients once the illness or disease is already there. And so I agree with you wholeheartedly. Okay, let's move on to your innovation. And then we're going to dive a little bit more into the other, which is you, dive more deeply. So, it's so funny because vaccinating is not something that's new. And yet I do consider you an innovator because we need to think about how to spread the message that vaccinations work and that they're important. So tell us about your innovation and what you're doing to make a difference.
Absolutely. And I really don't feel like it's that innovative. I feel like it's just maybe my over enthusiasm behind it is maybe what's driving it more. So, really, I feel like this past year of COVID has been such a challenging and a trying time for so many of us, and I'm really trying to focus on those silver linings, right? And what's positive. So, the phrase "let no crisis go to waste" keeps coming to my brain almost daily. And back in, this is even before the vaccine was on the horizon, some other members of the young physician section of the California Medical Association and I kind of were talking about stuff, and we should do something. This is ridiculous. One of my colleagues had done a lot of sort of grassroots organizing before medical school. I had done a lot of social media work. We're like, look, we should combine our resources here and create a digital grassroots movement to build vaccine trust, right? And we know good data from the Kaiser Family Foundation showed that it's not about, regardless of age, demographics, race, political preference, your physician is the number one most trusted source for COVID vaccine information, right? Talk about primary care and relationships and trust building, right? And so what we want to do basically is help physicians, and SoMeDocs I think are a great example of this, break out of the four walls of their clinic, of their hospital, to spread their message and reclaim the narrative in many respects. We know over 2/3 of adults get their vast majority of their news from social media, and there's a huge amount of disinformation, which is just mistaken, but then there's also disinformation, which is sort of nefarious and insidious, which is trying to sow mistrust in, you name it, any kind of public health issue. And so we really want to help amplify physicians' voices and encourage other physicians to speak up, and other healthcare heroes, not just physicians. We have nurses, we have pharmacists involved as well, to basically spread their message, share good, accurate information within their networks to be those trusted messengers for particularly the COVID vaccine, and then encourage the people within their field of influence and within their networks to then spread the message from there. And it becomes an iterative process, so that the ripple effects spread and reach the entire community. Because as a family physician in California, I can do a million webinars, but a physician from Florida, for example, who speaks their language, who's from their community, is going to be far more impactful within that community. And that's really the goal, is to have all of us amplify our voices to spread good, accurate information and really reclaim the narrative, and fight back against some of this misinformation and disinformation out there.
Beautiful. Actually, can we talk about that for a second off script? I just want to get your opinion on that fact that narratives are now sort of leading us in our lives. It's the narratives that are going on social media. Is that scary to you?
I think, we basically have, whether we think about our personal choices or the policies we pass, unfortunately, we're not good at legislating and making decisions based on data. We make decisions based on emotions and stories and anecdotes. And so it's I feel like it's been that way for human nature for millennia, right? But now it's just being done in a much more public manner. And one person, there used to be this theory of, you could have conversations 1-to-1, right? And then the media, radio developed, and then you could have a conversation 1-to-many, right? And now social media, and you can have a conversation many to many, right? And so it's just amplifying, I think, what's already sort of been innate within human nature. So narratives are fine. And I think stories are fine, but I think we need to keep them within context. And that's what we lose sometimes, is when things are taken out of context, and those stories are just, flashed, and our attention span is 15 seconds. And, so it's an interesting problem to have. I don't think it's going away anytime soon. And I think we really need to think about how to address it. And particularly as the professionals within the social media space, I think we have a role to play there as well, too. I feel like, maybe this is a little bit harsh. I feel like physicians have abdicated their role within public health for probably the last 20 years, right? We've been slowly defunding public health for the last 20, 30 years. Physicians are stuck in the day-to-day rat race of patient care and charts and EHRs and clicky boxes. And I think we really need to think about how we can reclaim that narrative within not only vaccines, but any kind of public health, right? We're building this grassroots coalition right now in this moment for the COVID vaccine to get back to a COVID-free world, right? That's our goal right now. But this coalition could be so potentially powerful for the next public health crisis which comes along, or whatever the next issue is too. So we can work on combining and collaborating our voices in a much more unique and authentic way than just if a big medical group or a big corporate health enterprise says something. It's very different than when 100 physicians or 1,000 physicians say the same thing.
Absolutely. No, that's beautiful. And that's innovative for me, because you have to really work hard to think outside the box on how to get seen and be heard, especially the way that social media is run today. Okay.
Right.
Let's take a pause for a second and again, go to you. Who are you behind the white coat? So when you get home and that white coat is shed, what kind of person are you? Oh man.
You should ask my partner and my kids that question. I'm kind of a goofball. I love having, dance parties with my kids. I love building Legos with my kids. Actually, I joke that it's for them, but really it's for me. I'm the kind of person. When I used to go to the beach, like dig a hole in the beach, right? And everyone's like, "Oh, that's so great! You're such a great dad digging a hole for your kids." And I'm like, I'm not digging this for my kids. I'm digging this for me. It's fun, right? So I'm a little bit goofy. I'm a little bit kind of out there. I'm a big believer in practicing what I preach in terms of prevention and healthy lifestyles. I'm a huge believer in diet, sleep, and exercise. Those three things are very, very central to my life. Before my life as a physician, I actually raced as a professional triathlete for a number of years as well too. So I kind of take that portion and apply it to my sports medicine practice as well too. So I still, make sure I take time for my own physical and mental health every day. And then I really enjoy cooking, actually. I don't have much time for it these days. So whenever possible, lots of fruits and vegetables and healthy things as well too. So that's, I don't know. Does that answer your question? I feel like I'm not very interesting.
I love it. That was very interesting. First of all, I have follow-up questions, actually.
Okay.
The original Legos or the Legos with the instructions?
Ooh, both actually. Sometimes you just buy those big tubs of like 200 Legos and you just build whatever you want. But my kids love Harry Potter, so we've done all the Harry Potter Lego series. I think I've invested a small fortune in Legos. And then this is a little embarrassing, but I'm just going to throw it out there. For my birthday, my wife got me the Lego Bugatti Technic, which is like 5,000 pieces. It's like 18 plus Legos. It's adult Legos, and I'm slowly working my way through that. So it's just sort of something therapeutic and really fun about it too. So
oh my gosh, I love it. I first of all, my kids love it, and I was going to ask you, and you've answered it, about the bigger sized ones like the Falcon. What's it called? Falcon. What?
The Millennium Falcon and the Star Wars stuff?
Falcon, yes, the big Lego sets. You're probably talking about an equivalent, right?
Yeah, exactly. Yeah.
My kids do not want to hear that because they won't. And then second question, follow-up question is, what is your favorite meal to cook, or what's an amazing meal that you can cook to make us salivate / be jealous?
Oh man. What did I make recently? We made this the other day. We made actually a really cool, like a pork tenderloin with a carrot ginger puree, kind of like think mashed potatoes. And then we had just amazing roast broccoli with like garlic and olive oil and deliciousness. So nothing fancy, but just kind of back to basics.
Got it. And we, as in you do it like as a family?
Usually, yeah. Usually it's a family affair. My kids are still a little bit young to cook, but my 10-year-old has started not only learning how to, but volunteering to do the dishes. And I'm like, oh, please.
Right.
That won't last long, I'm sure.
Right. That's not like the building the sandcastle and the Legos, right? You don't want to do that.
Right.
Okay. All right. Next is sort of a follow-up, is just run us through your day, meaning tell us what a day in your life is like, so we kind of get to know a little bit more about you.
I usually get up around 5 or 6 and do some kind of a workout in the morning. Full disclosure, I have a Peloton bike and I'm slightly obsessed with it too. So usually do some kind of a Peloton workout, or used to go to the gym a little bit, but we actually have a lot of home gym stuff already pre-pandemic, and we've sort of built that up more. So I generally do either weights or running or cycling or something in the morning. Often make a quick breakfast for my kids, usually cereal, something like that. Rush off to work. Usually listen to some kind of podcast. I have about a half an hour commute to work. And I love podcasts. So I listen to, some of them are kind of more political. Some of them are more health related. Some of them are more public. I listened to White Coat Investor podcast recently. That's my most recent one. But then sometimes just crank out to Bon Jovi too, and just open the windows. My practice is I work in a large clinic, and there's a medical center right there on site as well too. So I generally will. It's highly variable. Some days I'll do procedures in the morning and then clinic in the afternoon. Sometimes I'll work, like right now I'm working in the hospital, so I just work inpatient all day long. Sometimes I will work with residents or sports medicine fellows in the morning. I'd say my time is split about 60% primary care, 30% sports medicine, 10%, 15% hospital. And so it's highly variable, which I really like. I hate doing the same thing all day long. So generally my half days are split up into different things. It keeps me a little bit happier. Usually lunch has some kind of a meeting. I'm involved in several different committees. Obviously working on This Is Our Shot, and our grassroots campaign is taking a lot of my free time right now. Crank through my in-basket later in the day. And then drive home listening to the news or whatever else the podcast brings for me. Make dinner for my kids. Recently, I've had some meetings in the evenings, but try to keep those to a minimum because of family time is important. And then read to the kids and put them to bed. And then usually my wife and I watch some kind of TV for an hour or two and just kind of veg out before heading to bed and doing it all over again. I feel like my day is not very interesting.
It does sound interesting, I have to tell you. You might.
Really?
But yeah, it does. So tell me, you don't have to do this if you can't think of one, but is there like one particular interaction that you can think of that has sort of made you do the things you're doing, the innovative things that you're doing?
I don't think there's one particular interaction. I think there's been a series of interactions. I think probably one of the most formative experiences I've had is when I was a resident. I kind of happened upon the California Academy of Family Physicians, and they had a resident and student council, and I kind of stumbled upon it, and I made some really, really amazing connections and found some amazing mentors, and then got more involved in the California Academy and realized that I could really, I didn't have to be sort of that Norman Rockwell physician that I sort of initially thought of. I could be Alex, I could be a little goofy, and I could think outside the box and try to help enact change with my communities through health policy, through social media, there's all these different tools. And really the end of residency is really just the beginning of your career and what you can do, and not just the end of your training, so to speak. So I think that it was probably a series of interactions, but that was probably that kind of getting involved with the California Academy of Family Physicians really kind of opened my eyes in a unique and different way that helped me to think outside the box.
Beautiful. So the next one's actually funny because you just said that your life's not interesting. And so is there one really interesting part of your life that you can tell us about?
Oh, my life's not interesting.
I think it is interesting. First of all,
right.
You build sandcastles and you love it, right? That's interesting too. All right, we could skip this one since you actually did tell us about many interesting parts of your life, but we're going to take a little break and ask you about, are you team coffee or team tea?
Oh, I'm coffee all the way. If my coffee is not dark enough that I can't stand a spoon up in it, it's not dark enough or thick enough. I drink. I like it black and dark, and tea is fine if you have a sore throat or if you have a cold with some honey. But generally speaking, I'm team coffee all the way.
Team coffee. And is there a particular brand or flavor that you really love, or are you just I love all coffee any way, shape, or form?
Well, I'll take it any way I can get it. But if I had a choice, I'd probably say Peet's coffee is my favorite. I can't get it very often where I am, unfortunately. But I'd probably say Peet's coffee is my favorite, followed by Starbucks, followed by any other
form of coffee.
Love
it. You touched a little bit on this earlier, but is there a particular resource that you can recommend? And it literally could be a book, podcast, or TV show. I know you said White Coat Investor, who's great. That's a podcast. You mentioned that you watch TV with your wife. Is there a TV show that's been great? Listen, it could be a resource for people listening. That's obviously for innovative minds versus a TV show that you recommend that's just great to watch and veg out to.
Yeah. Right now we're watching episodes with Matt LeBlanc, which is I think it's a little bit older TV show. It's awesome. I don't know why. I just love it. It's fantastic. But then also in terms of like books, I love Adam Grant. He's written so many great things. I'm drawing a blank on the name of the book, but it's about It's about innovators. It's about kind of thinking outside the line. I wish I could draw. I'm going to think of it as soon as we hang up this video call. But Adam Grant, anything by Adam Grant is amazing.
Yeah, and listen, nowadays you could literally hop on a computer and just find the work of the people that you recommend. But Adam Grant's great, and he's also on Twitter and he tweets great stuff.
Mm-hmm, he does.
So, this is sort of towards the end of this episode where I ask you not for your weaknesses because I want to highlight the things that you fail in, but because I feel like innovators' pitfalls and weaknesses teach not only them, but teach us. So have you had a weakness or a pitfall that has taught you something that we can learn from as well?
I feel like I have a lot of weaknesses. I think my biggest weakness is my brain moves very quickly and my mouth can't keep up with it. Oh, and my fingers when I'm typing. And I can't tell you how many emails I've sent that are like littered with typos. And I'm like, oh, it's like so unprofessional and embarrassing. I think sometimes I need to kind of slow down a little bit and not be so excited. I tend to be kind of an all or nothing type of person. So rather than just kind of slow and steady, I'll do things in like fits and starts. And I wish I could kind of just be a little more consistent sometimes. And part of that too is just, the nature of life, I think, and the ebbs and flows of work. When I have time for something, I'll get super invested in it and maybe go too deep into the weeds. And then sometimes I'll have to take a step back and not touch it for a few days or a week or two. So I think I wish I could find just a little more consistency in my life as opposed to sort of just like all or nothing. I think I really I'm kind of a people pleaser. I love people. I love interactions. I love communication. And I feel like sometimes I need to worry less about what people think and just do what needs to be done. And I think, that's no one wants to have people sort of upset with them or mad at them. But I think sometimes I try to please people too much and I need to just be a little more, I don't want to say hard line, but I need to be just a little more kind of true to myself and authentic for what I need, and not worry and abdicate so much to help other people feel good about themselves also.
Totally resonates. I think that a lot of physicians struggle with this. I think we're just altruistic. We're good people who went into medicine for good reasons. And sometimes you do need to advocate for the things that you need. So I love that. And it's a perfect time to advocate for what you need, because the last thing we're going to ask is, what is your ask for people that are watching?
I think, I want, especially your audience here. You build this amazing community on SoMeDocs, and it's so cool to see how people are really kind of expanding things. My ask for any physician, social media, health advocate out there, regardless of who they are, is to speak out about. Don't engage disinformation directly or misinformation, but spread your truth. Spread good, accurate health information. And particularly right now surrounding the COVID vaccine, use "this is our shot" hashtag "this is our shot." Follow and amplify our social media channels as well too, and interact with us. Right? It's social media is social, right? It's give and take too. So don't just like our stuff, comment on our stuff, interact our stuff, share our stuff. We'll do the same for your stuff as well too. So we can kind of all be in this new social world together to help really spread accurate, good health information. Like I said, right now, this is our shot, and the COVID vaccine is kind of the most important thing. But really, whatever the next public health issue is, there's likely going to be I'm not going to predict particular tea leaves, but likely there will be some major health legislation coming from DC in the next two years, right? And we as physicians need to speak up on that, because we are the experts on what happens in the clinic and in the exam room, and we can't abdicate that responsibility to administrators and public elected officials. Maybe they're very well-meaning, but they don't understand what medicine is the way we understand medicine.
Beautiful. All right. What a perfect place to stop. Thank you so much, Alex, Dr. McDonald, for joining. And you can check out all about the innovation that we are highlighting about Dr. McDonald on the website at SoMeDocs.com. So thank you for joining.
Thank you so much. This was a pleasure. I really appreciate the opportunity.
Absolutely.